Hello guys, Dr. Sarabjit Singh here. Today I shall be discussing with you a very common disease in India which is called diabetes. In Punjabi it's very common also. So I'll be talking to you about diabetes, which in Hindi is called madhumeh and in Punjabi it's called sugar di bimari. So I shall be talking to you about that today. So let's go and have a look what it's all about. Hello, today I shall be talking about diabetes, which is also called blood sugar, high blood sugar. An overview. Diabetes is a disease that occurs when your blood sugar level goes too high. Blood sugar is the main source of energy that comes from food you eat. Insulin, a hormone made by the gland pancreas, helps glucose from food get into your cells to be used for energy. That means when you have food, especially carbohydrates and sugars, they get absorbed from the stomach and they go into the bloodstream. But from the bloodstream, for the blood sugar to go into the cells, they need insulin. If there is decrease in insulin or the sensitivity of the cells is poor, then the blood sugar cannot go into the cells. If cannot go into the cells cannot use it for energy. Over time, having too much sugar in the blood, however, can cause health problems. Although diabetes has no cure, you can take steps to manage your diabetes and stay healthy. Now, prevalence in India, diabetes currently affects more than 62 million Indians, which is more than 7.2% of adult population. The average age on onset is 42.5 years. Nearly 1 million, that means 10 lakh people in India, they die due to diabetes every year. And many of them actually go blind because of diabetes. Common types of diabetes are type 1 and type 2. We will be more interested in type 2 in this lecture. So in type 1 diabetes, your body does not make insulin. Your immune system attacks and destroys the cells in your pancreas that make insulin. Type 1 diabetes is usually diagnosed in children and young adults, although it can appear at any age. People with type 1 diabetes need to take insulin every day to stay alive. Now, type 2 diabetes. In type 2 diabetes, your body does not make or use insulin well. You can develop type 2 diabetes at any age, even during childhood. This type of diabetes occurs most often in middle-aged and older people. Type 2 diabetes is the most common diabetes, so today we will be focusing on type 2 diabetes. And then there are other types of diabetes which I will not mention here. Now there are risk factors for diabetes. If you are 45 years or older, if you have family history of diabetes, if you are overweight, and then physically you are inactive, you're not doing much activity, then race Indians are known to have more diabetes in them. Then high blood pressure. If you have high blood pressure, you are more prone to diabetes as well. And usually it's a lifestyle disease. Now, health problems diabetes can cause. They are heart disease, stroke, that means paralysis, kidney disease, eye problems. There are plenty of eye problems which can occur because of diabetes. I shall be making a separate lecture on just eye diseases because of diabetes. And then you can have dental disease, nerve damage, and foot problems. Foot problems, you must have heard of gangrene, where the foot has to be cut or amputated. Then symptoms of diabetes. Many people just don't have any symptoms of diabetes. Some of them will actually have thirst and increased urination. They might have to wake up in the middle of the night to pass water. They can get hungry very quickly, and then they're always tired, always feel tired and fatigued. There can be blurred vision, either because of high blood sugar or because of complications of diabetes in the eyes. Then there can be numbness or tingling in the feet or hands. Haath so jate hain. Then there can be sores that do not heal, that means ulcers or which do not heal on any part of the body. Then there can be unexplained weight loss. They are eating quite well, but they are still losing weight. And there can be some other symptoms of diabetes as well. Now, how do we prevent diabetes? Is it preventable? Yes, we need a disciplined and healthy lifestyle to try and prevent diabetes. You must lose weight and keep it off. Like if you are 100 kilograms or 90 kilograms, you must lose at least 10 kilograms for the diabetes to keep the diabetes at bay. You should be more active, at least 30 minutes every day, 5 days a week. And you must eat healthy food most of the time. I shall be coming up with more videos like this, especially to tackle with weight loss and then how to stay more active, what kind of exercises you should do and how to do them, and what kind of food is good or bad for diabetes. So keep in touch, subscribe to my channel so you don't miss those important videos which will be coming very soon. So then, what tests do we do for diabetes? One of them, of course, very important one is the fasting blood sugar. Usually we should keep it below, if it is below 100, then probably the person is not a diabetic, or it is a very well controlled diabetic. Then there is random blood sugar. If the random blood sugar is beyond 140, usually we consider it as diabetes or pre-diabetes. And then if we might need to do actually a glucose tolerance test, in which we give oral glucose to the patient, and after 1 hour and 2 hours and 3 hours we check their blood for blood sugar levels. Your healthcare provider or your doctor will be able to interpret the results. Then another very important test is HbA1c, or sometimes we call it just A1c, or glycosylated hemoglobin. This is a very important test, and we have to keep it below 7 if you are a diabetic. The only thing is, if the patient is anemic, then this may actually give wrong readings. So your doctor will be able to interpret the results better. So how do you manage diabetes? Discipline, discipline, discipline. So that is very important. If you have discipline in life, it is not that difficult to manage your diabetes. Know your ABCs. A stands for A1C, which we already have talked about. You must try to keep it below 7%. B is for blood pressure. Keep it below 140 by 90 millimeters of mercury. C for cholesterol. There are two kinds of cholesterol, LDL, which is a bad cholesterol, and HDL, which is good cholesterol. This LDL, which is the bad cholesterol, can clog your arteries in the brain or in the heart, which can lead to a stroke or heart attack. Then S is for stop smoking. Smoking can be really bad in diabetes. Even otherwise it is quite bad, but in diabetics it can be worse. Many of the people who actually smoke quite a bit and they are diabetics, they actually lose their limbs to amputation. Then you must follow your diabetes plan, meal plan, what to eat, what not to eat. And then make physical activity part of your daily routine. You must every day do exercise or keep your body moving. Then Take your medicines if prescribed by your doctor. Your doctor will be the best person to tell you more about what medications to take, when to take, before meals, after meals. You must get all these answers from your doctor. He'll be more than willing to tell you all this. That in fact it's his duty to tell you all that. Check your blood sugar levels at home. It's very easy to do. There'll be a link somewhere up there. I have another video where I've shown how to check your blood sugar levels with a glucometer or glucose meter. So that video should be quite helpful to you. So guys, I hope this presentation was helpful to you. I'll be coming out with some more videos regarding diabetes, which will be more like on eye complications of diabetes, and how to have healthy eating, exercise, and how to keep your weight down. All those things I shall be coming with short videos very soon. So please keep in touch, subscribe to the channel so you don't miss those important videos.